All right, today we're putting on our detective hats to crack a really tough case, vasculitis. Just imagine a crime scene where the body's own blood vessels are the victims. The problem? Well, there are a ton of different culprits. And you know what? They all leave behind pretty much the same evidence. So let's get into it. And this quote right here, it just nails the heart of the problem. When a doctor looks at a scan, the damage, the thick vessel walls, the blockages, the scary ballooning parts, it all looks identical. It's like trying to pick a suspect out of a lineup where everybody has the exact same fingerprints. It's tough.
So that's the million-dollar question, isn't it? If you can't just rely on one single smoking gun piece of evidence, how in the world do you figure out which specific disease is the bad guy? How do you go from just a hunch to a real diagnosis that could literally save someone's life?
Well, the answer, it turns out, is to stop hunting for that one single clue. Instead, the real pros, the seasoned detectives, they look for a special combination of clues, a pattern. They use this kind of mental cheat sheet to connect the dots and build a rock-solid case against one specific type of vasculitis.
So what's on this cheat sheet? It's actually beautifully simple. It all boils down to asking 3 basic questions that help you narrow down the list of suspects like you wouldn't believe.
First, you ask, what size vessel is under attack? Are we talking about one of the body's superhighways like the aorta, or are we looking at the tiny little side streets, the capillaries? Second, who's the patient? Their age, their gender, even their background can be huge clues. And third, what are the key signs? Every one of these diseases has its own signature move, its own MO, that really sets it apart from the others. Okay, let's kick off our investigation with the large vessel suspects. These are the culprits that target the biggest, most important arteries in your body. We're talking the absolute superhighways of your circulatory system. Our first suspect is Takayasu arteritis, which has this wild nickname, the pulseless disease. Now, what's really fascinating here is just how specific the profile is. The classic patient is a young Asian woman, usually somewhere between 15 and 30 years old. And its MO, it almost always goes after the aorta itself, the biggest artery of them all. Suspect number 2 is giant cell arteritis, or GCA. This one is actually the most common of all these diseases. And its profile, it's the total opposite of Takayasu's. Here, we're looking at much older patients, usually men in their 70s or 80s. And for the location, the source gives us a great way to remember it. Think about the area that gets squished by crutches, the subclavian and axillary arteries, right there in the armpit area. So let's put them head-to-head for a second. Takayasu, you've got a young patient, and the aorta is involved. Giant cell, older patient, armpit area is involved. See? This just brilliantly shows how just 2 simple clues, the patient's age and where the attack is happening, can almost instantly tell 2 major suspects apart, even though they might look exactly the same on a scan. Okay, let's move on to our next group of cases. We're now looking into the medium-sized vessels. So not the superhighways, but all those essential main roads that branch off to the major organs. And the prime suspect here is polyarteritis nodosa, or PAN. Our source gives us this handy little mnemonic to remember the profile. PAN is more common in a man. Its MO is also pretty unique. It creates these teeny tiny little weak spots called micro-aneurysms in the arteries that feed the kidneys, the heart, and the gut. And get this, here's a wild piece of trivia for you. That same pattern of microaneurysms in the kidney, it's not just from PAN. It can also be a sign of crystal meth abuse, which leads to something grimly called a speed kidney. It's a perfect example of how completely different culprits can leave a nearly identical clue behind. Next up, we have a very special case, Kawasaki disease. The patient profile is our biggest clue here, since it's one of the most common vasculitis we see in children. It really likes to attack the coronary arteries, the ones that are on the heart. And its key signs are pretty unmistakable. A high fever that just won't go away, a bright red tongue that looks like a strawberry, and this very specific rash on the palms of the hands and soles of the feet. All right, now we get to the most complicated part of our whole investigation, the small vessel diseases. The evidence here can feel like a really tangled web, so our medical detectives need an extra tool. These suspects are actually broken down into 2 groups based on a blood test for something called ANCA. It just helps split them up. First up, the ANCA-positive suspects. We've got Wegener's, which has this classic trio of targets, sinuses, lungs, and kidneys. So you're looking for things like nasal perforation or these hollowed-out spots in the lungs. Then you have Churgstrass, which is almost always linked to a history of asthma.
And finally, there's microscopic polyangiitis, which also hits the kidneys and lungs, but its calling card is often massive, widespread bleeding inside the lungs. Now, on the ANCA negative side, two suspects really jump out. First is Hanoch-Schoenlein purpura, or HSP. This is another one that targets kids, but unlike Kawasaki, the main clues here are GI symptoms, which can sometimes lead to a really serious bowel problem. And then you've got Buerger's disease, with a profile that's crystal clear: male smokers. Its unique MO is the growth of what are called corkscrew collaterals, these new, twisted little blood vessels that the body creates to get around blockages, usually in the hands and feet. So after we've gathered all our evidence, it's finally time to bring all of our suspects together. Let's take a look at the final lineup and see how our little diagnostic cheat sheet has really helped us crack this case wide open. And here it is, the final lineup, our entire investigation right here on a single slide. You can just see how the patterns snap into place, telling the difference between a young patient with Takayasu and an older one with giant cell, or spotting the totally unique MO of Buerger's in a male smoker. So the whole point is this: it's never about just one isolated clue. The case gets solved by recognizing that unique combination of vessel size, patient profile, and P signs. And that kind of leads us to a final thought. This whole detective-style approach, this pattern recognition, it's not just for vasculitis. It really makes you wonder, doesn't it? What other super complex medical mysteries out there get solved not by finding one single simple cause, but by skillfully piecing together a unique pattern of clues that, at first, might not seem related at all?